Hi everyone, it's Dr. Danielle Cooper here, plastic surgeon. Today I'm creating a video to discuss the difference between awake versus asleep liposuction. So liposuction is a procedure that we do very commonly. It's actually the most common procedure that we do as plastic surgeons, where we use a metal cannula or a metal rod to remove fatty tissue from underneath the skin to better contour and shape the body. So most commonly we perform this procedure with you completely asleep under general anesthesia. So that's when, like I said, you're completely asleep, you're unaware, you don't remember anything. Usually there's a breathing tube and you're hooked up to a machine to breathe for you during the procedure, and then you're woken up at the end of the procedure by the anesthesia provider and you go to recovery. The alternative to that is awake liposuction, where in this case you are awake. How we are able to achieve this is first, sometimes we give you medications by mouth to help relax you, and then whenever we're doing liposuction, we inject a fluid to help with controlling pain, controlling bleeding. It also helps to loosen up the fatty tissue to make it easier for liposuction. We call that tumescent fluid. So as I alluded to, in this fluid there's medications that help with pain control. Usually it's lidocaine. So for awake liposuction, we really depend on that lidocaine to keep the areas that we're doing surgery on numb so that you can tolerate the procedure. So the difference is when you're completely asleep, you're not feeling anything. And so even though we may put lidocaine in the tumescent fluid, even if we didn't have the lidocaine, you still necessarily wouldn't be feeling anything because you're completely asleep. But we're able to perform the procedure and we're able to be a little bit more aggressive when you're completely asleep. And what I mean by aggressive is that we're able to be more thorough with how we're doing the liposuction, because we know that you're comfortable and you're asleep. And we can also give you medications through the IV while you're asleep to also help with pain control. Now with awake liposuction, we're again depending upon the lidocaine that we have in the tumescent fluid, and the lidocaine only lasts for so long. We add things like epinephrine to it so that it will last a little bit longer, and the epinephrine also helps to control with bleeding. But at some point that lidocaine is going to wear off, so depending on how much liposuction is being done, you may start to get a little bit more uncomfortable towards the end of the procedure as that lidocaine starts to wear off. So we may not be able to get as much fat as we would have normally if you were completely asleep. So there's pros and cons to doing it either way. A lot of it depends on personal preference. It also depends on maybe your goals. If you're somebody who only wants a little bit of liposuction, you don't necessarily are looking to be as snatched as possible, you're just looking for a little bit more refinement. It also tends to be an option for people that are slightly higher in BMI as well, because you don't have that anesthesia risk with the higher BMIs. Those might be options for you. However, if you're somebody who is not afraid to be put under, who's really wanting to get as snatched as possible, then having liposuction done under general anesthesia may be the better option. But that is a decision to discuss with your surgeon on whether or not they even offer those two options, and then again, depending on what your goals are, what would be the best option for you. Now, either route you take, either completely asleep or with awake, there is a maximum amount that we can take off of liposuction anyway. That's 5 liters. That's for safety reasons, because it's been found in research that once you start going over 5 liters, it starts to lead to a lot of other medical issues in the postoperative period. So it's generally recommended not to do more than 5 liters of liposuction at a time. However, if you still have fatty tissue that's left over that you would like to have addressed in the future, you can always have that done in another round of liposuction. So I hope this was educational for you guys. If you have any questions, leave them in the comments below.